My name is Andy Bonilla, and I'm a student nurse with California State Long Beach, and today we're going to be talking about when and where to seek different levels of care. So some of the things that we're going to talk about in this video is ER waits and why they're so long. We'll be talking about alternative forms of healthcare that are available to the population to avoid and mitigate these ER uh, wait times, and when to access these different levels of care. So I want you to think about your experiences in the emergency room and how long you had to wait. For some, they might not had to have waited a long time. Um, I know for other people, waits can go up to 6, 7, 8 hours. I know for me personally, one time I went to the emergency room and had to wait 6 hours. Um, so ER waits are notoriously known to be pretty long. Um, so the average wait time in California ERs, we have researched to be an average of around 3.5 hours. Now that might not seem like a lot to some people, that might seem like a lot to others, but one thing is true. Imagine going to the emergency room and expecting medical attention and medical care and having to wait 3.5 hours to get medical care. So this begs the question, why are ER wait times so long? So, in order to understand this question and to understand the answer, we have to break down how emergency rooms work, and not only in California, but in the greater United States. So, US law dictates that emergency rooms that take Medicare funding must treat everyone that walks in for medical assistance. In other words, ERs cannot turn down walk-ins if they want to keep receiving Medicare funding. Now, of course, um, this means that people of all different levels of severity in their conditions will receive treatment from the emergency rooms. Um, so, other things that affect these long waits are staffing shortages, patient volume, and resource availability in emergency rooms. So, imagine a large influx of patients that cannot be turned down occurs on some day, and an ER might be short-staffed, or they might not have as enough, you know, perhaps availabilities of machines and whatnot to provide adequate care. But the most relevant reason for long wait times is the triaging system. So you may be asking yourself, what is triaging? So triaging is this process of sorting and prioritizing patients based on their severity and the urgency of their clinical presentation. So take somebody who comes into the emergency room for 8 out of 10 abdominal pain, right? Versus another patient who might come in, altered level of consciousness. They're not responding. They're not breathing. They might not have a pulse. Who is an ER going to see first? They're going to see, the latter patient. Um, so in ERs, severity dictates priority. It's not first come, first serve. So if you end up in an emergency room and you might not have as much as a highly critical, presentation as somebody else might be having, you're going to naturally wait longer in an emergency room. So it's important to understand the way that this severity is dictated in emergency rooms. So medical professionals will assess criteria like vital signs, their ability to breathe, mental status, circulation like pulses, and resources needed to provide care for a patient to categorize these patients into this 5-tier category. So this 5-tier category is known as the Emergency Severity Index. So at the top, you have your level 1 patients. These are patients that are immediate, they need immediate medical attention or else they will die. Think, you know, heart attack patients, stroke patients, patients after a major car accident that are like actively bleeding out, right? These are your level 1 patients. As we go down the list, the presentations become less and less urgent. So you have all the way down to the level 5, which is non-urgent presentations that will naturally have a much longer wait as higher level patients are being seen first. So emergency rooms prioritize these level 1 and level 2 patients, while these lower level patients, like levels 3, 4, and 5, have to wait much longer to get care. So a lot of the times, these level 3, 4, and 5 patients can go to other more time-effective options that exist for them, but they might not have the knowledge or the confidence to navigate these resources. Think urgent care rooms, same-day doctor's visits, routine doctor's visits. These are some of these resources that they can navigate. So the point of this video is to get you the right care at the right place at the right time. So we're going to talk about how to navigate these healthcare options that are available to you. And I want everyone watching this video to think of the healthcare landscape as a ladder, or the healthcare options as a ladder. At the bottom, you have your routine doctor's visits. Think things that are more or less pressing. And as you become more and more, as your presentation becomes more and more severe, you're going to navigate higher level resources as you go up this ladder. So when you're navigating resources, start at the bottom and work your way up. So we'll start at the bottom of this video with your routine provider visits, or PCPs. So these routine doctor visits are the home base of healthcare. Think, non-emergencies that don't need to be addressed within the same day. So a routine doctor visit can be something for like chronic conditions, checkups and monitoring, medication management, asking questions about refills, asking questions about minor side effects, these mild kind of persistent symptoms that don't affect day-to-day life but are still there, like aches, pains, allergies, or mild allergies. And of course, you have your preventative care, like vaccines and screenings that you might do routinely and don't need pressing attention. So for these situations, these are situations that can be wait until the next scheduled doctor visit. These are mild, not new presentations that don't impede these day-to-day activities. So this is the start of the ladder. As you go up, we're going to go to your same-day PCP visit or your telehealth. So sorry about the formatting here, but these are problems that are new, impair day-to-day activities, and can be addressed in the next 24 to 48 hours, so they don't need immediate attention. And usually something like an inspection or a conversation can address these problems. So persistent symptoms, like we talked to, these like symptoms that have persisted for a while, but they start to become severe. That's something you'd view or see your same-day doctor or a telehealth visit for. These mild signs of infection like fever, sore throat, these painful urination, flu-like symptoms, minor sprains with mobility and the ability to bear weight on them. So these are presentations you can safely stay home for, but they can't wait several days to be treated. You can't wait until your next doctor's visit to treat this worsening symptoms or these minor sprains and whatnot. So this is when you would go to your same-day doctor visit, or you'd access a telehealth visit, something like a video chat call with a doctor that you would see the same day. As you move up, you would go and see your urgent care offices or your urgent care services. These are for symptoms and presentations that need attention today, because waiting can make it worse. You may need extra equipment that you might not have at home to treat them, but they're still not life-threatening. So you have symptoms of worsening infections, like worsening fever, chills, maybe some nausea, but there's no alterations in consciousness. This is important, and we'll discuss it when we get to the next, to the ER section. Bleeding that is controlled, but still needs something like stitches. So let's say you were to cut your hand, cut your finger. Obviously, you can control it with a bandage of some sort, but you still need extra equipment that you don't have at home to close it up. Minor burns, not to the face and mouth. Injuries that might need x-rays, casts, or splints, some sort of extra equipment. And chronic condition flare-ups that aren't severe, so like something like an asthma flare-up that is controlled with medication. So these are presentations that need attention today, but you're still breathing and thinking fine, and you need resources that are not available at home. This is when you'd find something or go towards urgent care. Next, we have our emergency room. So like we said, this is our level 1 and level 2 presentations. Life-threatening, immediate attention is needed, and they might result in death, could result in death. So what is something that is considered severe? When we talk about severe, we're talking about these parameters, something like intense pain or injury, impaired breathing, uncontrolled bleeding, or changes in mentation. So we're actually going to go through these one by one to find specific examples of these kinds of presentations. So intense pain and injury, of course, this is something like crushing chest pains, pressures that radiate to the arm, especially with shortness of breath or dizziness. This is something that is consistent with a heart attack. Serious injury like a car accident, a head injury with some sort of altered mentation like your confusion, major burns to the body, especially to the hands and face, or sorry, to the face and mouth. These face and mouth burns can impact the airway, and larger burns can be more severe. Broken bones with deformities, especially if the bone is protruding out of the skin. These are some of the presentations with intense pain and injury that merit an ER visit. Impaired breathing. So especially if this is new on onset, you won't be able to speak in sentences. You'll see some bluing of the hands or the feet or the mouth. Allergic reactions that block the airway, or chronic condition flare-ups like asthma or COPD that aren't controlled by medication. So these impaired breathing presentations are likely going to be something that the ERs will prioritize. Uncontrolled bleeding, penetrating wounds like gunshots or stab wounds, open fractures like we said earlier, vomiting. All bleeding doesn't have to be external, it can be internal. Something like vomiting bright red blood or dark coffee ground blood might be grounds for an internal bleed. Stools that might be bright red or dark tarry and foul smelling also are indicative of internal bleeds. So these are telltale signs of uncontrolled bleeding that will merit an ER visit. And finally, we have changes in mentation, especially new of onset. Any sort of ranging from confusion all the way to complete loss of consciousness that is not explained by anything else will merit a visit to the ER for sure. It's important to recognize signs of stroke. You can recognize this with the BFAST acronym. Balance, so if you have some sort of balance issue. Eyes, so vision changes in the eyes. One-sided facial drooping like we see in the top right. Arm weakness, especially on one side. And speech changes, so slurring of speech, not being able to understand words. If you see any of these presentations, it's time to call 911. So this is some of the things to watch out for that might merit an ER visit. So now you have learned a bit about when and where to access healthcare. Now it's time to test yourself. So for the following scenarios, decide if you would choose a routine doctor visit, a same-day doctor visit or telehealth, an urgent care visit, or an emergency room visit. So as we go through these, feel free to pause and take a second to think about the answer before we reveal it for you. First up, sudden 10 out of 10 chest pain that moves to the left arm and makes you dizzy and nauseous. Take a second to think. This is a classic sign of a heart attack, which merits an emergency room visit. It's important that not all heart attacks will result in chest pain. It might be a chest pressure, but especially if this comes with dizziness, nausea, and radiation to other parts such as the left arm. Or left chin as well as another one. The chin is a big one. So yes, emergency room. Blood pressure that has been high for the last 2 weeks, no other symptoms. Higher than your usual blood pressures and no other symptoms. This is probably a routine doctor's visit. If it's something that's not causing any other symptoms, especially if you have a history of hypertension and it's just been a bit higher for the last 2 weeks, no other symptoms like headache, then this would be something to discuss with your routine doctor visit or even a same-day doctor visit. Cough for 10 days, now getting worse, but you're still breathing fine. So this is a persistent cough that's starting to get worse, but it hasn't impacted your breathing. This is the same day PCP and telehealth. It could be grounds for urgent care as well, but for the most part, if you're breathing fine and it's just something that seems to be getting a bit worse as of late, it's something that you should talk to your doctor as a same day visit or a telehealth visit. Finally, wrist painful and swollen after falling. You can't really move it too much, but there's no head injury, so your head is completely fine. Think about it, think about it, think about it. This is something you could go to urgent care for. If it's swollen after a fall, you might not be able to move it very much. It could be something that might need a splint or some sort of x-ray for. If there's higher level of care needed, they'd refer you to higher levels, maybe an emergency room if they see it's broken. Painful urination for 2 weeks, fever, 6 out of 10 back pain, and new onset confusion. This is a little hard one. Take a second. Be an emergency room visit for sure. It's new onset confusion is the key part of this. Remember, changes in mentation is one of the big criteria for an ER room visit that they will prioritize. So this is indicative of a fever that's getting worse and should definitely see an emergency room for this. Of course, when you're in doubt, call your primary care provider. You can call a nurse advice line or a 24/7 telehealth service. You do not need to navigate healthcare alone. We will upload a cheat sheet in the video description that can help you make quicker decisions with regard to your healthcare and navigating resources. But of course, trust your gut and take medical advice from these aforementioned resources, your nurse helpline and the 24/7 telehealth service into your decision making. Thank you for watching. We appreciate you watching. Thank you.